screen.
Truly, you can see the attendance.
Hi, everyone, and welcome to the learning session, Improving Equity in Health Services by Improving Measurement of Wealth in Programs and Policies. My name is Alex Ergo, and I have the honor to be the moderator for this session. So equity in health can be defined as the absence of systematic disparities in health or its social determinants between more and less advantaged social groups. Now, there are many ways in which we can define social groups. We can do that based on gender, on age, on ethnicity, on religion, place of residence, type of occupancy, educational level, or, and this is the focus of this present session, on socio-economic position. Now, we all know that there are important socio-economic inequalities in health. If you compare the health of the poorest 20% of the population to that of the best of 20%, you're likely to see very big disparities. And just as an example, there was an analysis of DHS data, the demographic and health survey data from 56 countries that revealed that, for example, a poor infant is more than twice as likely to die before reaching the age of 1 than a better off infant, or the adolescent fertility rate is 3 times higher among the poor than among the better off, and the list goes on. So why do we see such disparities? Obviously, there are many reasons, but one of them is health systems failures. If you compare the health service utilization by the poorest 20% of the population to that by the best of 20%, again, it's very likely that you'll see huge disparities. And here again, I could give you a number of examples from this same analysis of DHS data. A poor pregnant woman is more than 3 times as likely to give birth at home than a better off woman, or a poor child is half as likely to have been fully immunized than a better off child, and so forth. So the question is then, what can we do about such inequalities? A good place to start is probably to make policies and interventions pro-poor and to monitor those inequalities. Now, monitoring inequalities is what's often missing. Policymakers, implementers will often state that their policies or their interventions are reaching the poor without really measuring whether that's truly the case. And there's a good reason for that. Measuring socioeconomic inequalities in health is not easy. It requires measuring socioeconomic position, and how do you do that? If you were to ask that question to a poverty economist, the answer you'd get is probably that you would need to estimate consumption expenditure, which is a money metric measure. But that's a lot of work. It involves long questionnaires, endless list of questions, and that's being done in large representative population surveys, such as the Living Standards Measurement Survey, which the World Bank conducts in many countries. But few implementers or few researchers have the means to do that. Another way would be to construct a so-called wealth or asset index, which is some sort of proxy measure of socioeconomic position. You'd ask households a number of questions relating to the characteristics of their housing, the type of roof, the type of walls, about access to basic services such as water, electricity, sanitation, and about ownership of assets. Do they have a mobile phone? Do they have a car? And so forth. And you would then combine all the answers into an index that will give you a relative measure of wealth. While that's already much easier than estimating consumption expenditure, it still requires a considerable amount of work and asking quite a long list of questions to households. So then you can ask, is there an easier way? And luckily there is, and it's called the Equity tool. And that's precisely the focus of this session. So over the next couple of hours, you will learn more about the Equity tool and its uses through 5 presentations. After that, we'll have time for Q&A. And I'd like to encourage you to post your questions on the HSR 2020 platform in the live Q&A section next to the screen. And if you can, please specify to whom your question is addressed. And then a few other points that I'd like to raise your attention to. You can ask for live support, as you see on the screen. It's best to move to full screen for a better experience. The sessions are being recorded and they will be available for the next 14 days past the conference. And last one, please adjust your browser zoom ratio to 67% and play the session in full screen by selecting the enlarge icon on top right of the session window. So without further ado, I'd like to introduce you to our first presenter, who is also the organizer of this session, Nirali Chakrabarti. Nirali is the Director of Research and Technical Assistance at Metrics for Management, or M4M, which developed and supports the Equity tool. M4M develops simple and standardized measures for assessing health services performance. So Nirali will set the stage by introducing the Equity tool, what it is and how it's constructed. And if everything goes well, we'll also get a little demo. She will then present M4M's latest tool, which is the Asset to Income Estimator. And this latest tool allows to move from a relative measure of socio-economic position to an absolute one that's expressed in dollar per capita. Nirali, over to you.
Thank you very much, Alex. And thank you all for joining our session this morning, this afternoon, or this evening, wherever you may be. Today, we'll speak briefly about what the Equity tool is. Dr. Ergo did a great job of explaining the rationale behind it. And I will go a little bit further in describing how it's created and what it allows a user to do. And then at the end of my presentation, we'll briefly touch on a complementary tool that we just developed called the Asset to Income Estimator. As he just mentioned, there are many different ways to measure socioeconomic status. We can look at an individual or a household's income in dollars or local currency. We can use a tool called the Poverty Probability Index, which is now run by Innovations for Poverty Action, which provides an indication of whether or not a household is below the $2 a day or $5 a day poverty level. We can use a tool called the Multidimensional Poverty Index, which was developed by Oxford University several years ago, which looks at different aspects of income and poverty, including housing status and education and ability to access transport. We could use participatory methods, which are often used in small communities where the community's knowledge itself is used to understand who within a community is maybe most in need of a particular intervention. And finally, we can use the wealth index or the asset index, which has been most widely used by the demographic and health surveys, but is also used in a number of other settings now. The use of wealth quintiles has become very popular in the last couple of decades, and they're popular in assessing comparing health status by relative wealth or poverty. Also, they've been used in understanding access to water and sanitation. For example, to what extent do the poorest in urban areas use improved sanitation as compared to the wealthiest? They've been used in educational interventions and in many other settings. Nevertheless, using wealth quintiles is a little bit complicated, particularly if you're trying to implement them in a programmatic setting and not just use published data. So from a programmatic viewpoint, there are high data requirements. For example, in Burundi, to understand the wealth status, you would need 31 questions and 99 variables, or 36 questions and 112 variables in Guatemala. The data collection process for that is a little bit time consuming, and the analysis can be prone to, the analysis can be complex, and the data collection can also be prone to some inaccuracy, particularly if you're outside of the household setting. So the equity tool set out to simplify the process. And what we did was we first looked at the standard DHS wealth index, which you see in the leftmost column, and said, what are the aspects of that wealth index that exist, and what could we look at to try to take out to simplify the wealth index? And then we created alternative indices indicated here as A, B, C, and D. And for example, in alternative index A, we took out all of the country-specific variables, leaving only the core set of variables that are common to all countries. And in index B, we took out all variables except those that are common across countries. So we also omitted variables on animal ownership and residence. And in so doing, we were able to see what is the effect of different ways of shortening the asset index. So we did this preliminary analysis for 16 countries and produced these 4 alternative wealth indices. We compared each of them to the full index from the DHS, which was the gold standard, and assessed the percentage agreement and the kappa statistic against that gold standard. We then convened an expert panel for review and discussion, and with the help of that expert panel, decided to conduct a 5th analysis based on their feedback. And we set these following priorities. Priority 1 was to reduce respondent burden, to have the shortest number of questions possible for any given country. Second, we wanted to ensure that the index had utility in urban settings in addition to nationally, because we know that urban poverty manifests itself differently. And finally, as an expert group, we set a particular threshold for what level of accuracy in comparison to the gold standard we would accept, knowing that we are trading off some accuracy for simplification. Experts included members from a wide array of different organizations who are both users and developers of asset index type tools. And in this alternative index, the one that we finally chose, we have country-specific variables, common variables from the DHS questionnaire, and are able to distinguish between urban and rural residents. We do not ask questions about land ownership. And to the extent possible, we do not ask questions about animal ownership because these are sometimes hard to answer outside of the household setting and can be prone to inaccuracy. So what did that result in? Well, shorter indices were possible. So for example, in Burundi, instead of 31 questions, we have 12 questions in the equity tool, and the number of variables reduced from 99 to just 14. And similarly in Guatemala, from 36 to 11 questions, and from 112 variables to just 12 variables. Questionnaires overall for all of our equity tool countries can be shortened by 70%. And they're not just shorter because there are fewer questions, they're also shorter because the questions themselves are shorter. There are fewer response options. The methodology behind the equity tool is quite transparent. So there's a published article, and for each country, there is a fact sheet available on the website. What I'd like to do now is invite all of you to try the equity tool. So if you can open a browser window or use your phone to go to this link, tinyurl.com/et-Burundi, you should come up to an equity tool questionnaire for Burundi. And I'll leave this screen up for just a moment, but then I will switch screens myself to show you what it would look like. And please feel free to complete the questionnaire as yourself, as a hypothetical citizen of Burundi of any socioeconomic status, just so that we can see what it would look like if you or your organization were collecting data. At the top of that, you would be able to choose between French and English for Burundi, which we have translated into French. But I will go back just in case anyone needs the link again. And since it's quite a short questionnaire, hopefully it won't take too long to complete. And I am now switching my screen to show you what it would look like live. So this is the equity tool for Burundi, and I can complete it quite quickly on a tablet or a computer. And submit it. And we use the Kobo Toolbox platform, which is a free to use platforming, which can also be, you can also add questions to it if you need to. And we know now that this particular tool was submitted. Now, this tool was created under my account as the administrator. And so I'm going to show you the administrator settings. So I have several different surveys, and what we can do is for Burundi, we can sync the submissions. So there were already 15 submissions that have been inputted for Burundi. We'll see how many of you have inputted any. Okay, so now we're up to 28, and we can view the report. So the analysis is done on the back end if you're able to use the equity tool platform, and if not, you can use your own data collection tool. And what does this show us? This shows us that of all those 28 submissions, which is not that many, 79% are in the wealthiest quintile, and less than 4% are in the poorest quintile. If we imagine that all of those respondents lived in urban settings, and we wanted to see how that distribution looked for urban residents, we see that it looks different because urban poverty manifests itself differently. So here what we see is that 32% of the respondents are in the poorest urban wealth quintile. So they're amongst the poorest urban dwellers in all of Burundi. I'm going to go back now to the PowerPoint. There are a few acknowledged limitations of the equity tool. So the first is that the equity tool is dependent on having a nationally representative survey. So in order to create the equity tool, in this case for Burundi, we needed a benchmark data set. And that benchmark data set has to have those asset ownership questions. The type of data set that are available to us to use are most often the Demographic and Health Survey or the UNICEF Multiple Indicator Cluster Surveys, mixed data sets. We can also use Malaria Indicator Survey or AIDS Indicator Survey data if they're sufficiently representative. Sometimes in some countries, they're not nationally representative. And on the rare occasion, we've used other data sets that are available to us that aren't proprietary. Another limitation is the timeliness of comparison to the benchmark. So we imagine are collecting this data today in Burundi, and the benchmark data set is from the year 2017. So as a program implementer, you just have to consider, if that is what that means for the data that you're collecting. And in practice, what it means is you are assessing the wealth of people in comparison to the wealth of the population in that country in 2017 or in the year of the benchmark data set. The equity tool or any asset index is not designed to measure seasonal or transient changes in wealth. That's actually one of the benefits and drawbacks of an asset index. So it was designed instead of asking income, which in many countries fluctuates seasonally, we can imagine that assets may be slightly more durable. People don't sell off their assets as quickly and have to collect resources in order to change the type of housing structure that they have. But as a result, if there's a sudden shock in the economy, that won't be captured through an asset index. And finally, the asset index provides us information on relative wealth, but not on absolute wealth. So we can understand if someone is in the poorest wealth quintile in Burundi or the poorest wealth quintile in Guatemala. But from this data alone, we can't understand what that means one in comparison to the other. And this has been something that program utilizers of the equity tool have struggled with for a few years now. And so in response to that, I just want to take 2 minutes to introduce the asset to income estimator. So we launched the asset to income estimator just this year in June of 2020. And so this conference is our big debut. And it adopts the methodology that was published by Kenneth Hartgen and colleagues in 2013. And what it does is it provides, using the wealth distribution from something like the Demographic and Health Survey in conjunction with publicly available information from the World Bank on a country's Gini coefficient and median income, we're able to provide the real value for an individual or a household's daily, monthly, or annual income. And this is an estimate, okay? But what it does is it does provide a real figure to use in comparison or in conjunction with the relative values that you're getting from the equity tool, if you so desire. And what does it look like? So the asset to income estimator is found on the Metrics for Management webpage. And if you look at a multi-country comparison, you could select one of a number of countries that are available on our tool. And in this case, we're going to look at the comparison between Cameroon and Ethiopia. And what happens is for each quintile, you're able to see what is the median income for the household. And you can look at that annually or monthly, and you can look at that for an individual or for a household. We also have another feature, which is a more interactive feature. And if we were to take those same two countries in the interactive feature, what we are able to see is how income changes over the course of the wealth distribution. So in this case, one line represents Cameroon and the other line represents Ethiopia. And you're able to see how income grows. You're also able to see for any given amount of income, what quintile that household or individual may fall into with the same annual, monthly, or daily selections. And the last thing I'll mention as part of our introduction to the equity tool is that Metrics for Management is going to be launching an equity measurement prize in the coming year. And you can find out more about that prize on the equity tool website. But the purpose of the prize is to demonstrate how wealth measurement can be used to better serve the poor. The equity tool is currently available in over 60 countries, and we are always adding to the list of countries as we are able to get the benchmark data sets. Thank you very much for your attention, and I'm looking forward to hearing from the rest of our panelists to see how they have put the equity tool into action in their programs.
Thank you for this great presentation, Nirali. I think the work that you and your colleagues at M4M are doing is really making it a lot easier for implementers and researchers to measure the extent to which interventions reach the poor. And also the asset to income estimator that you've just demonstrated opens up a lot of new exciting opportunities to measure equity. So now that you've set the stage, we'll turn to some practical applications of the equity tool. Again, if you have any question, please post them on the HSR 2020 platform in the live Q&A section next to the screen. And if you can, specify to whom you're addressing your question. So now let me introduce you to our second presenter, Ian Jones. Ian is the Senior Global Technical Lead for Economics at Sightsavers, an international NGO working to eliminate avoidable blindness and promote the rights of people with disabilities. Ian will discuss the different ways in which Sightsavers uses the equity tool that Nirali just presented. He will then describe in a bit more detail how the equity tool helps track the performance in terms of equity of one particular initiative, namely the Cataract Development Impact Bond, which is being implemented in Cameroon. Over to you, Ian.
Thank you very much, Alex. If I can just share my screen. Hopefully everyone can see that. So yes, thank you. Good morning, good evening to everyone. I hope you're all safe and well. And thank you to Nirali for the excellent presentation and organisation of that session. I do recommend participants to look at the paper that she mentioned, but also the Metrics for Measurement website. There is an awful lot of information on that website. As Nirali mentions, they are very open. So I do recommend people just having a look at that website. So I'm going to, as Alex mentioned, just discuss when we have used the equity tool and pull out some lessons from our use. And hopefully I can move this on. There's a slight delay. Okay, so just to begin with, a little background on Sightsavers. As Alex mentioned, we're working to eliminate avoidable blindness and promote the rights of people with disabilities in over 30 countries, mainly in Africa and Asia. And we're working across health, education, and also employment. So for eye health, we're looking at refractive error, for example, cataracts. And for inclusive education, we're promoting inclusive quality education for all children. And work in inclusive employment, for example, we're looking at ensuring adults with a disability have the same opportunities for work as others. So, you know, increasingly across all of those programs, we're interested in assessing the accessibility of our programs to vulnerable groups. And as part of this work, we're a founding signatory of the Inclusive Data Charter, which is looking at the importance of data disaggregation to deliver on the SDGs. And you know, given the aims and our program focus, it's really important that we as an organization ask if our programs are inclusive and we are reaching the poorest. Are we delivering on our commitment to leave no one behind? So to do that, we're using a variety of tools to measure equity of our programs, including the equity tool. Now, we've used and have used the equity tool across a number of our programs in different locations, but also different types of interventions. And I should say I need to acknowledge a number of my excellent colleagues across Sightsavers, particularly in our country offices, who have done this work. I'm relatively new to Sightsavers, and I cannot take credit for all this work. But if you go to the website at the bottom there, they're all available, and you can see the work that we're doing using the equity tool. So just on the range of programs we're looking at, so you know, we're looking at willingness to pay for eye health in urban informal areas in Asia. We've used it for population surveys in neglected tropical diseases, for method administration of pensions, and interesting study looking at political participation and looking at the levels of participation of people with and without disabilities in elections and political parties, for example. But the focus of the next few slides are on the last there, which is the Cameroon Cataract Development Impact Bond, which is an interesting example for a number of reasons. It's the use of the equity tool is informing and assessing the achievement of an outcome in a performance-based instrument with a private hospital. So it's relatively unusual in its use. So just a little bit of background just for participants on development impact bonds. Very briefly, it's a performance-based instrument. It's a contract between investors and outcome payers, donors, for example, to deliver on agreed outcomes. Finance is provided up front, and the implementer delivers services to the target population to achieve a social outcome. And then there's independent verification of those results, and if the outcomes are achieved, outcome funders repay the investors. And so it's an interesting mechanism to deliver better outcomes. The Cameroon Cataract Development Impact Bond has a range of stakeholders. Just very briefly, they're all up there on the screen. Just as a background, the DIB was launched in March 2018. The initiative provided an initial loan to the Maghrabi ICO Cameroon Eye Institute, a private hospital about 20 kilometers outside of the capital. And the hospital is adopting a cost subsidization pricing mechanism with diversified revenue strategies to provide quality cataract surgeries to poor at low cost or no cost, while raising revenue from wealthier fee-paying patients. Now, there are a number of outcome measures used for the performance of this DIB. They're all linked to availability, quality, access, and sustainability. But the important one is the last one there, which is around equity. And the outcome we're aiming for is that 40% of the cataract surgeries, the patients belong to the 2 poorest quintiles by the end of year 5. Now, if that's achieved, the hospital will receive a bonus payment. And in order to measure progress towards that equity target, we're using the equity tool. Now, the use of an equity outcome as part of the DIB outcome is fairly ambitious, and it's fairly innovative, and it's helped influence the design of the intervention as well. So, for example, the hospital deals with an awful lot of walk-in patients who are fee-paying, largely from the urban area, including the capital, which is quite close. However, the equity target has influenced the design of an outreach program to reach the poorest. So this is traveling 1 to 3 hours drive away from the hospital to rural peri-urban areas. And why I mention that is that it then informs the use of the equity tool. And using the national measure was seen as more accurate and fair to measure equity, given the breakdown of the patients that this hospital is seeing. Now, it's not been without challenges in terms of the first year or so in measuring equity. Not only the measurement, the monitoring and verification of the target. For example, you know, there's been some work on the consent forms, on when the survey was carried out, and there's been a lot of work to refine our use. But there's also some ongoing work just to make sure the tool is accurately measuring equity. So the DHS that was informing the equity tool was from 2011. The 2018 DHS has just been released, and Metrics for Management has just updated the tool. So given that the project started in 2018, it would make more sense to use that updated equity tool. So, you know, there's issues around that as well. There's some interesting issues that we have to look at in terms of the fact that we're using the equity tool in a commercial context. So, you know, what are the incentives at play here? So we need to just do some further thinking about the use of the equity tool there. And just as you're all aware, you know, the impact of COVID-19, it has stopped all outreach. So it will affect the ability to measure equity, particularly in 2020. But just thinking about some of the lessons across the Cameroon DIB, but also what we've learned across some of the other projects, not just the DIB. So we found that equity tool really useful. But it's a relatively simple way to collect and analyze data on equity, on socio-economic position, in a standardized format. It's relatively low cost, which is great. It's a short questionnaire, and we found that you don't need specialized skills to implement it. It's validated for each country, as mentioned by Nirali. You know, it's reliable for both urban and rural contexts. And related to this, you know, it's using DHS tools and data, which is well understood by local stakeholders. So when, you know, we're communicating findings, it's relatively well understood. It can be used for population-based surveys and program facility level surveys in a variety of contexts. You know, we'll see that from the presentations after me, but also, you know, where Sightsavers have used it. One aspect that we've looked at in a couple of examples of Sightsavers' use of the equity tool is that we found that it can actually be used as a self-reported tool. So in a study in Malawi, the household and dwelling data was self-reported initially, and then there was a number of household visits were organized to a randomly selected number of individuals. And we found that there was a high degree of agreement, 80%, between the household wealth based on the self-reported characteristics and when we visited. And finally, it's allowing us to capture an awful lot of data on the household, which simply wasn't there before. And there are very few, if any, other relative measures of wealth. And it's another sort of, you know, it's another useful tool in our armory. But we've also faced some challenges, and Nirali mentioned a few of these, but I think I should say some of these issues are not unique to the equity tool. I still think they're helpful just to note. So it's a household measure. rather than an individual measure. And it's great to see that work on the assets to income estimator. But for us, you know, some of the common, some of the issues we have, I suppose it's best to explain this with an example, speaking to a colleague recently about access to cataract services. So older, often female populations may well live with younger family members, and because of those assets that they have, doesn't necessarily represent the willingness for them to pay for that older lady's cataract surgery. So it's that individual level that we need to really get down to. You know, it's a simple approach, which is great, but does it lack some of the nuance? Does it produce simple data? So, you know, that I think Nirali mentioned a trade-off between accuracy and simplification. I think that's right. You just need to bear that in mind when you're using it. One issue that related to that is if all participants in the study area are poor, you're not going to pick up quite a lot of, you know, you're not going to pick up that variation. So you need to look at perhaps supporting that with other tools. Just be aware of that. Programs that we have often work in a very localized way, and so, you know, we require local cutoffs, regional district cutoff points, which are not always available, which is another issue that we're just, you know, you need to tackle with and think about. Nirali also mentioned that, you know, it uses DHS and MIS. Now, if they're not up to date, you just need to be a little bit careful about that, particularly in fast-moving developing economies. So you just need to just make sure that you're aware of the context, and as wealth generally increases over time, comparing your respondents to a relatively old benchmark, you may well be overestimating the relative wealth in your society, in your survey. Now, we've done some further work in one of our programs, which was using a relatively old DHS. It looked like we weren't targeting the poorest. We did some work in updating the new DHS, and we found that we were better at targeting the poorest. So you just need to be a little bit careful, and I know that there are some options that metrics and management suggest you can use to do that work. Finally, you know, we've often find that data analysis can be a little bit difficult as groups become quite small in size. And so is there a standard way that you can group the quintiles, and does that grouping, you know, lose some of the nuance in the data? Finally, because I realize I've probably taken too much time, it's vital for Sightsavers to assess if we're reaching the poorest. And we've found that the equity tool is, you know, easy to use. It's widely accepted by our country teams and partners, and it's really supporting our improved decision making in terms of tailoring our approach to reach the most vulnerable. But like most things, context matters, and it's important to understand the context when you're interpreting the results. You know, for Cameroon, for example, and the DIB, the political and security issues, you know, we're wondering whether they're actually influencing the responses that we're seeing and some of the use of that tool. There are some caveats in the equities use, such as regional data, which I've mentioned, the most up-to-date cutoff points, which I've mentioned. So you just need to take account of that when you're planning to use it. But for us as an organization, we're committed to strengthening the collection and of use of data, you know, committed to the Inclusive Data Charter and to ensuring that no one is left behind. We're going to continue to use the equity tool, perhaps part of a more comprehensive equity analysis looking at gender, age, disability status, and absolute and relative poverty, which is great around the assets to income estimator. Finally, there's an expression around the importance of using the right tool for the job. I think actually if you extend that a little bit and make sure that you're doing the right work in terms of measuring the right issue at the right time with the right tool, I think the equities tool certainly can be a tool in certain circumstances. And I'll leave it there. Thank you very much.
Thank you, Ian, for this great presentation and also for sharing all these very valuable lessons. I think it's a very interesting example of a practical application of the equity tool. And as we see financing arrangements such as the development impact bonds that you described and others such as impact investing becoming more and more important, I think this will need to be accompanied by improvements in the way we are able to track social impact. We need to come up with better, more reliable, more cost-effective ways to measure the impact, the social impact of investments. And what you've just described, I think, is a good example of a simple, low-cost approach to include the equity dimension in that measurement. And I think it should definitely be part of the toolbox moving forward. Our next presenter is Kenda Cunningham. So Kenda is a public health nutritionist. She's currently working with Helen Keller International, where she's the Senior Technical Advisor for Integrated Nutrition and Monitoring, Evaluation and Research in the Swahara 2 project. She's also Assistant Professor in the Faculty of Epidemiology at the London School of Hygiene and Tropical Medicine, where she's got her own doctoral degree. Kenda is also recruitment, engagement, and outreach counselor with the Society for Implementation Science and associate editor of the Maternal and Child Nutrition Journal. Kenda will take us to Nepal. She will describe how the equity tool is being used in Swahara 2, which is a USAID-supported integrated nutrition project. Kenda, over to you.
Thanks, Alex, for the kind introduction. And I just want to echo Ian's thanks to Nirali for organizing such a session to allow us to discuss the equity tool. So I will just share my screen so that we can discuss our use of the equity tool in Nepal. So as was mentioned, I'm the Senior Technical Advisor with Helen Keller International of a program known as Swahara. It's a USAID funded initiative. We are now in year 8 or 9 because we're building on Swahara 1, which was also a 5-year investment. And Swahara 2 has recently received an extension to be a 7-year program. So it's an overall 12-year investment by USAID. And you can see at the bottom of the screen that while Helen Keller International is the lead of Swahara 2, it's implemented by a consortium model with other organizations, both international and Nepali. So before I jump into the equity tool, I just wanted to provide a bit of context for those who might not know Nepal. Nepal is a small country sandwiched between China to the north.
Kenda, sorry to interrupt you, but your screen is not showing. We just see you, but not your slides. Can you please start your presentation?
Oh. Okay, sorry.
Sorry about that.
No, thank you for letting me know. Is it showing now?
It is, yes, thank you.
Great, thank you. Okay, so I was just on this first slide explaining that Nepal is situated, it's a small country and it's sandwiched between China, which is to the north, and India to the east, west, and to the south. And what that means is that you have extremely diverse populations because the top part of the country, Nepal has 8 of the world's 12 tallest mountains, but it goes all the way down to the southern part of the country, which are the lowland plains. And in the middle, you have what are called the hills in Nepal, which if you're in Europe, you would consider that height to be a mountain. So as you can imagine, there's a lot of geographic diversity, but there's also a lot of cultural diversity. And this also relates to equity, as different areas of the country are involved in different types of trade and there are different wealth generating or not wealth generating opportunities in the country. So we cover all of the areas that are in yellow in this map. And we do not choose villages to work in, rather we have what's called a district-wide approach. And we focus on the 1,000-day households, which for those who are not in the nutrition sector, what that means is a household between conception and a child turning 2 years of age. This is a critical window of opportunity for investments to be made to prevent malnutrition. So we reach about 2 million households that are in this period across the communities that you can see in the yellow area. As a program overview, we're mostly working on social behavior change initiatives. So there's interpersonal communication, where we have about 1,500 frontline workers around the country who are implementing via home visits to discuss health, family planning, WASH, agriculture, nutrition, gender and social inclusion, and other thematic areas that we work on with these households, because we know that nutrition, the causes of malnutrition are multi-sectoral, and therefore so are the solutions. We also work in a community mobilization model in which we do food demonstrations, hand washing demonstrations, and celebrations of a birth, a child turning 6 months of age, and so on, as examples of some of the community gatherings and the group model approach that we use. We also have a radio program which began in Swahara 1 known as Banchanama, What Mother Says. And the evolution of this program has included in Swahara 2 new characters, such as an adolescent girl, a father-in-law, a husband, and so on, in recognition that a family approach is important and not just mothers and children. And the most exciting new evolution is that it's no longer just a radio program with a call-in component, but people can engage with Ama, the mother, via Facebook and the YouTube channel as well. And of course, there's also now a mobile technology component where we're using videos, interactive voice response, and SMS campaigns as another opportunity for reminding households of certain key behaviors and to seek health services. This slide is not intended for anyone to be able to read, but it's to highlight what happens when you have a program that's operating across many different sectors. The color coding are the different sectors: green for agriculture, red for health services, blue for water and sanitation, and so on. And what you can see is that sometimes those sectors converge and come together. The activities that we're doing, not only the social behavior change activities at the household and community level, but also the systems level work that we do in these different sectoral areas, and the policy work that we do is all aiming to reduce maternal and child undernutrition. And you can see at the bottom here, there's a circle around gender equality and social inclusion. These are our cross-cutting themes, which go along with monitoring, evaluation, and research, as well as coordination with the government. And this means that gender equality and social inclusion is a goal of ours through all the activities, processes, outputs, and outcomes that you have above. And as several of the presenters before me have mentioned, the challenge when you have words like inclusion and equality into a framework is how do you actually measure that and ensure that at all levels you're achieving your goals in that area. So the first thing that we need to make sure is that we're targeting accurately and that the packages that we're developing to implement at a field level are actually relevant for the populations in that specific place. So we have, as I mentioned, we cover all the core areas. This is more than 20,000 communities across Nepal. All of those communities receive what we consider to be our core package. This involves what you can see in the first box and which I've already explained. In some of the areas which are needier than other areas, there's also a core plus package where primarily we're doing more market linkage work and providing agricultural inputs as well as WASH inputs and other interventions to try to bring these communities up to the level and close the gap between the core communities and the core plus communities. This was the design from Swahara 1 and was using the government's determination of which villages were more needy than the others to choose where these extra inputs went. The last time the government did this targeting exercise and this rural appraisal approach was around 2010. So we really struggled with how do we know for sure that we're identifying the neediest populations for the program, and especially in Swahara 2, when these government rankings of communities were not updated. And also we know that within a community, although the community overall might be at a certain level, there will be variation by household within that community. So we learned about the equity tool and we're quite excited to adopt it into our program. As I mentioned, we had about 1,000 field staff at the time, now around 1,500. And we developed something we called the community mapping census. You can see one of our frontline workers pictured here holding a smartphone. We gave all of them a smartphone with our census tool built into the phone using the ComCare application. And the purpose of this was to be able to collect basic socio-demographic information. If you have ever collected roster information at the beginning of any survey, it's quite similar to that. And we rolled it out between January and April 2017, piloting in a few areas first before rolling it out at scale. One of the key lessons that we've learned is that demographics change. So while some of our districts were quite excited to announce that they had gone to all of the households door to door, we quickly had to explain that demographics change and that updating of the community mapping census would be an ongoing activity. The equity tool was built into the community mapping census. In other words, in Nepal, as was mentioned, there are now 9 questions that are required. 5 assets, kitchen fuel, as well as the 3 housing characteristics of roof, walls, and flooring material. Those are the questions that we ask in this tool so that we can later identify which households are the neediest within a given community. So what we do is we integrate this data collection activity into our program activity. In other words, she is not only at that household to be a data collector, she is there to actually impart information. Because this is a 1,000-day household with a small child, she will engage in counseling about appropriate feeding and a maternal diet and maternal rest and other activities. She will also announce about the Banchanama radio program I mentioned, and she will check to see if the child needs to be referred to health services because they might be severely, acutely malnourished. So it's an integration of program and data collection activities happening at the same time, and the equity tool is integrated into that data collection activity. As of today, we have about 10.6 million people living within 2 million households that have been registered and for which we have collected this equity tool data. So once we collect the data, the question is, what do we do with this data? And I wanted to share a few examples. There are many that we could share, but given time, I'll just share some of the highlights. So we have used the household score for some activities that we have, which have quite limited resources to them. For example, in year 2 of this Water 2 program, we had some wash inputs. We had water filters that we could distribute, and we wanted to do this in a way that made sense and was systematic. So we used the household score to identify which households fell below a certain level. And we also integrated that because for us, the equity score is about wealth and socioeconomic well-being, but there are other dimensions to equity, such as geography, caste ethnicity, and so on. And so we were able to use equity score as one of the components into the decision-making criteria for the targeting of these limited wash inputs. We have done similarly for limited agricultural inputs to decide on which households get which one. And as was mentioned by an earlier speaker, because there's so much understanding of the DHS and the assets collected there, explaining this even to local level governments has actually been quite a smooth process as to how we choose. We've also been able to share this information with the government and explain to them the complementarity of the government approach, which looks at community level rankings of how disadvantaged the population might be, with our approach, which then takes it a step further and looks at the households within the community for additional targeting. There's a lot of government interest now in using this type of data. We also use it for our local frontline workers. Not only do they have one application from ComCare in which they're collecting the data, but they have other applications that have been developed that are job aids, and the 2 applications talk to each other. So the information that is coming in related to the equity tool is actually informing an overloaded frontline worker how best to target, where to prioritize, which households might need his or her attention more than other households if unable in a given month to visit all the households. We've also shared our community average score. So we're able to kind of identify what the equity level of a community is by aggregating up from the individual households. And this has been used by several international NGOs as well as the government of Nepal in targeting relief aid, because this type of data is not really held by the government or others within the country. And oftentimes relief aid that comes for floods, earthquakes, COVID-19, and so on is limited, and there's a need to target the neediest households. So this data that has been shared with the government in an anonymized way so that they can distribute aid appropriately. And most recently, we realized in the COVID context and the post-COVID context, when we're scaling back and implementing for our final 2 years, that we will need to have a sustainability model and scale back our own cadre of frontline workers. And therefore, we use the equity tool again to identify where we should prioritize field staff and which areas perhaps would not be as needy of additional field staff and could rely more heavily on the government field staff. So how can you include equity when you're monitoring programs over time? So this is a map again. The red is similar to the yellow areas you saw in the very first slide. We have an annual survey that we collect every year. I won't get into the methodology in detail, but I can answer questions. It's a repeat cross-sectional design using multi-stage cluster sampling, which means that we've randomly sampled districts as well as multiple levels to get down to clusters, communities, and households. This is a survey of households with a child 0 to 5 years of age, occurs every year with approximately 3,650 households. And we added the equity tool into our annual survey so that we would be able to see how our program indicators are changing over time with an equity lens. So what you can see here is just a quick example. I think this is in line with what others have been talking about, how you can look at the different equity quintiles and see whether the changes that are happening over time, whether you're closing the gap. So you can see here that the blue and the green, which are the lowest two equity quintiles, started with the least number of antenatal care visits, or the less prevalence of mothers attending at least 4 antenatal care visits, which is the protocol in Nepal. And that gap is very much narrowing, so that those households in those lower equity areas are beginning to come up to a similar level to the higher equity levels, which is what we would expect given the programmatic use of the equity tool to target these needier households. And this is a slide just to show that while, as I mentioned earlier, we do use the equity tool as a very important part of how we do our targeting and how we monitor our program, we also recognize that there are other dimensions of equity. And sometimes I think one of the challenges we have is that with different ways that you look at equity, your targeting might be different. So if you're looking at agroecological zones of mountains, hills, and terai, and where the progress has been over the 2 years, it might look very different as to which communities you should prioritize than if you're just using the equity quintile. So we do try to have a comprehensive approach, but I think this is an ongoing struggle for implementers worldwide. When the data, the more data you have and the more information you have, sometimes it can guide you in slightly different directions, and choosing how to prioritize remains an ongoing conversation. So as I mentioned some examples previously of how we have used the equity tool that we were collecting from our mapping census, which was mostly about targeting and distribution of inputs, we're also able to use our equity tool results from our annual survey in different ways. As the example showed, we can assess whether the programmatic activities and the investments we've been making are closing the gap between the needier communities and the relatively more well-off communities. We use this to facilitate really detailed work planning on a semi-annual basis to identify the subpopulation groups where progress is and isn't happening, and to tweak those programmatic activities and that targeting. It also provides evidence for discussions with government, and we can learn about how to define equity and achieve equity in some of our outcomes to push our other development partners within Nepal to not only think of overall outcomes, but how those outcomes may vary by subpopulation. I just want to close by saying that while the SWAHARA program is quite large, at this point over $100 million investment from USAID and going on year 9 of 12, it is not only, it's a lot of people who are involved. Every district is implemented by a local NGO partner. You can see the logos there. We also have a lot of public-private partnerships working with us, and the main consortium partners of SWAHARA 2 are at the bottom, and there were additional partners that were a part of SWAHARA in the first 5 years, the SWAHARA 1 program. And of course, everything we do is in line with and in support of the government of Nepal's multi-sectoral nutrition plan and with USAID mission. Thank you.
Thank you for this excellent presentation, Kenda. I think it's a great example of how the equity tool can be used to guide and monitor implementation of an intervention. Before we move on, I'd like to remind all the participants that if you have any question, please feel free to post it on the Q&A section next to the screen, and then we'll go through all the questions that have been posted after the last presentation. I would like to introduce you now to our fourth presenter, Grégoire Lurton. Grégoire is data science, Grégoire is a data science lead at Blue Square, which is a global data company with headquarters in Brussels that develops digital solutions for low and middle income countries. He's a data scientist and public health specialist with considerable experience in the field of health metrics. He's currently supporting the integration of advanced data analysis into routine systems for performance-based financing and disease surveillance in various countries in sub-Saharan Africa. Grégoire will use the example of Benin to illustrate how the equity tool can be used to track performance in the context of results-based financing. Grégoire, the floor is yours.
Thank you, Alex. I'll share my screen right now if I can. Yep. Oops. Okay, thank you, Alex, and thanks again, Nirali, for inviting us to present the results of these projects that we worked on. So I'll be presenting in behalf of my colleagues who were involved in the implementation, and I was not at the beginning of the program. I'm going to present, so some things I might not have the details on, and I must acknowledge also my colleague Leandro Sorunde, who has been participating in the design of this presentation. So the example I'm going to show is the example of results-based financing in Benin, which is a program that was implemented between 2012 and 2017 in Benin. The basic principles of results-based financing, as you are familiar with a lot of people, facilities in health districts are contracted with a central level of the health system, and they contract on a set of services they need to provide and on which they are going to be paid. The payments to the facilities then is determined by two main components. First is the quantity of services that are going to be provided by the facilities, and then is the quality of those services. And the quality is based on checklists that are being collected during supervisions of visits by the central level agency to monitor the quality and the evolution of this quality in health facilities. So in the system in Benin, all those data on quantity and quality and even payment was being collected, and then data is being published openly so that it's transparent. And as you can see here, there is this portal online that you can visit if you're interested, where you can look at all the data on where the services were happening and what the quality of services are, and you can also go on and see the payments that were being made and the evolution of the program. So that's the program, the way it was designed. But later on in the program, and as it was being implemented, questions arise surrounding, how to ensure that the strategic purchasing and that the purchase of care and services through this RBF program would benefit the most vulnerable populations in the country. So this question was delineated through two main dimensions. The first is how to ensure that the RBF incentivizes provision of services that will benefit the most vulnerable populations, and not only services that will benefit a richer population. And we want to be sure that the services that are being prioritized by the program, meaning the list of services that are being contracted, are actually some services that will benefit the most vulnerable populations. And then the second aspect is to make sure that the checklist and what is included in the definition of quality of care is really in line with expectation of the most vulnerable part of the population, and is not guided by expectations and and experiences from the more affluent part, and maybe more with the part of population with more voice. In order to do that, what happened was the introduction later on in the program of a component of community verification. What we call community verification is basically sending, during the phase of verification and data quality auditing, sending community workers collect information on patients that attended care. So we keep a running list of those patients, and patients are sampled, and then community health workers visit them, pay them a visit, and ask a couple of questions on the effectiveness of the services they received, and on the satisfaction they had on during this care, and the experience they had during their visit. As part of that, it was also asked whether we could monitor the equity and the economic background of the patients. And so, as part of this community verification, we added an aspect of equity tool for monitoring equity of the services. So as Alex mentioned, Blue Square is a software development company. And so what we did here was to implement a system. And so just wanted to mention the system and the different components, because some of them might be of interest to different people in the audience. But basically, Niralis showed that the equity tool was implemented in Kobo. For this use, we re-implemented the tool in ODK, because that's the tool that supports the rest of the data collection process for the community verification. And these goes through an app that we created called Data Collect. And what Data Collect does is it allows you to get data on health facilities and indicators to and from DHIS2, which is the tool that is used by a lot of health information systems to monitor indicators from health services. And so there is this interoperability between data being collected through ODK and then exchanged with DHIS2, which allow you, for example, to link the data you're collecting to the actual health pyramid and the health facilities as they are being recorded and coded through the National Health Information System. Then this data is being sent through to DataVis, where the data can be visualized, and that's the portal I showed earlier. And the whole computing aspect and invoicing aspect of the system is made through a specific piece of software, which is called OpenRBF2. So you have here a full system where you collect data on a regular basis, data on services, data on quality of services. There is some computation happening for defining, what the invoice amount should be, and then you have a final component where that is the data visualization. And I would say one of the benefits of the the equity tool is that it was very easy and very simple to implement in that framework, and it was really easy to include in this full stack and pipeline of data. So what are the results that we can get, and what are the information we got from this implementation? So we interviewed later in the program around 1,279 patients. First thing that was, interesting to look at is how was the equity tool aligning with other measure of wealth that we were having in the program. And one of the questions we had as part of the community verification was the eligibility of patients to free healthcare based on evaluation by the community of the wealth of the patients. And so this is quite interesting, because you see, for quartiles 2 to 5, we have quite a lot of signal here, and we have pretty good. We could think we have a quite a good predictor of eligibility to healthcare if we used the equity tool. We have some low results in the first quintile, and discussion among the team was that part of that was because a lot of people from that first quintile that would be classified in that first quintile came from more rural and poorer areas. And as I mentioned, the eligibility to healthcare to free healthcare was defined by the community as identifying who were the most vulnerable. And so you have a selection bias here happening, where in poor communities, you had an undersampling of those, or under selection of those poor patients to access free healthcare. But as a first, consideration, this aspect of the validation of the tool was very interesting, very positive for us. Second thing we can do is really mapping populations. So when we collect data on patients and when we interview them, there is some data being collected. And that allows also to map, and previous speaker mentioned that, to map more affluent and less affluent communities in the country, and also to link them, as I mentioned, to the specific health facilities, which are the stars here in the map that you can see on the right. We can define the catchments of the different facilities and understand what are the populations and what profile the populations that will attend those facilities, what they have. So that's a second interesting aspect, that we're able to really understand better who the target population are and who is attending the different facilities in the country. The third aspect that we are being monitoring here is the expectations of population. So here, what you see, and the legend is in French because that's how the data was being collected. You can see why the different patients attended these health facilities. And so what you can see in orange is that the first expectations is that the health facility was actually closer to the patient. And the two other series with some signal, which is the blue one and the brown one, is having a more affordable and less expensive care in those facilities in blue, and in brown is having competent health workers and good health workers working in the facility. And so that's something that is quite interesting here, that you can see that for the poorer quintiles here, we can see that their expectations is really geared towards having closest access to health facilities, and the skills of the health worker is less of a concern for them at that point. And you see these inverse correlation for the skills of the health workers between the lowest and the highest quintile. In terms of satisfaction and what constitutes the expectations in terms of quality of care, what I'm showing here is the evolution of cleanliness of the health facilities by different quintiles of the population. And what you can see here is that blue being very clean, and orange and green being acceptable and unclean. You can see that there is also this kind of inverse correlation between being very clean and just acceptable cleanliness. And that's something that I think is interesting in terms of what data we collect and what we are measuring in terms of quality. And the definition of what constitutes cleanliness, can be expressed or understood differently between groups. And so when we define this cleanliness as an appreciation by the patient, we don't really know what we measure there and what's included there. And so the feedback that we give to the team in terms of how we can measure quality, the idea is maybe to have a clearer definition of what we understand as being part of cleanliness and what we should put there for the appreciation and the satisfaction of the patients. Once we've interviewed what the patient would expect and their experience in the facility, we also can know why people attend this facility. And here we also see some differences in the distributions and in the regions for consultations by patients. What you see in blue here is other types of what is called other types of consultation. So it's consultation with no specific no specific reason, or not a reason that the patient was able to express when he was interviewed by the community worker. What you see in red also here is prenatal care. It's CPN data. So here we see two different things, and I'll come back to that a bit later. But you can see that for lower quintiles, for quintile 1 to 3, the reason of care is hard to to express, especially after a couple of months, maybe after the consultation. And also, what we have here is a signal of higher access to CPN for the more affluent quintiles, which is that's data that still needs warrants more deeper analysis and maybe additional interviewing and analysis. But that's also here we have some signal that we can base some reflection and some action on to try to understand better the populations and how we can best serve their needs. Here, that's also something that's quite interesting. What you're seeing here is what are the services that were received by the population, by the patients. And one of the things I really want to draw your attention to is here the proportion of prescription of consultations for which you had only prescription of drugs, and drugs were delivered, but there is no sense of having a consultation, meaning an interview and a relationship between the patient and the health worker. And this is something that we also find in more qualitative data. And this idea of having a poorer and more vulnerable population coming to the health facilities and not having access to a full consultation, but really coming here to get some prescription without so much of a fully fledged consultation is something that is we want to draw attention to the program in terms of the treatment and the quality of care that different population would get and would have access to. And so that's something that we can here measure and then put in front of the deciders to try to see how we can incentivize, for example, better consultation, or how we can target less affluent population for better experience in the health system. So I'll just here give some conclusions and feedback from that program. First, and as I mentioned, is that it was very positive for us to have a tool that allowed us, to trust that we had a well-calibrated measurement of inequities or equity in the health system, and that was really a tool that was providing good signal that we could talk about. It's simple to implement in an ad hoc data collection tool, as I mentioned. This was the implementation was re-implemented in the tool set that we are using for the program. And so, as Ian mentioned, the documentation is fairly transparent for the Equity tool, and it's something that is really easy to implement in the stack and use in our stack. The signal that we get also from the data is very relevant for us to give guidance on how to improve the strategic purchasing, both in terms of incentivizing services and also in defining what data is being collected and is being looked at to ensure equity. And so those two elements are really important, as they are key to driving and improving the RBF schemes in different countries. But, and that's the last point, this is something that we need to integrate early on in the program. And as I mentioned, the implementation of the Equity tool came relatively late in the program. And so the limited feedback that we're able to give was not sufficient to be able to change the program itself. But so that's really the main feedback here, is that this tool is easy to implement. We can implement it early on to be sure to get most information we need for the program. Thank you very much.
Thank you, Grégoire, for this great presentation. Yet another example of ways in which the Equity tool can be used to integrate equity measurement into innovative financing approaches. And I think when we talk about results-based financing, being able to incorporate equity in the monitoring of performance is particularly important, given the incentive that you kind of create for providers to improve their performance and maybe be tempted to focus on the better off, which are usually easier to reach. So very important to have that dimension built into the verification and the way you reward performance. Last but not least, I'd like to introduce our final presenter, Ellen Greggio. Ellen is program advisor at WaterAid, an organization that focuses on strengthening WASH systems through improvements to government-led monitoring, planning, and budgeting, and that advocates for evidence-based decision-making to achieve sustainable and universal WASH access. Ellen is an environmental engineer with over 10 years of experience in innovation consultancy, and international development. In her presentation, Ellen will highlight the importance of measuring equity in WASH interventions. She'll then introduce a mobile app developed by WaterAid in which the equity tool has been incorporated. And if we're lucky, everything works as planned, we'll get a little demo of the app. She will then say a few words about the work she's doing in Myanmar. Ellen, over to you.
Thank you, Alex, and thanks again for inviting WaterAid to share our experience of using the equity tool. So I'm presenting today also on behalf of my colleague, Tim Davies, who is a technical lead for monitoring at WaterAid Australia, while I'm based in the UK office. So I'm going to share my screen. Hopefully that will work well. Great. Hopefully you can all see the screen now. So as
can you go to full screen mode, please?
Yeah, sure. 1 second. Here we go. So the content of the presentation, as mentioned, was just a quick introduction to WaterAid, why we have integrated and how we have integrated the WALF indicators and the equity tool in our WASH monitoring, and then a quick introduction on how we're using the equity tool on our tool, as previously mentioned, and then some examples of its use in Myanmar in particular, and then just a point around learnings and next steps. So just a quick introduction to WaterAid. We're a WASH specialized NGO that works on WASH services in communities, health center facilities, schools, and public places. And our mission is really to target most marginalized communities to ensure sustainable and universal access to WASH services. And we work by combining two approaches, both a service delivery approach, where we provide best practice WASH services, combined with a WASH system strengthening approach, where we work with governments, service providers to ensure that the services that are being implementing are lasting. And to do this, we work in partnership with government, local NGOs, and private sector. And we work in an integrated manner with also other sectors, such as the health and education sector, to ensure that our work within this context is actually having a larger impact as well. So we work across 25 countries, and then we have offices in other 7 countries where we support our work across the world. And as mentioned, one of our approaches is very much to support government-led or sector-led system processes. As part of that, one of our key area of work is to support sector monitoring processes. And why is this? Well, within the WASH sector, as in other sectors, with SDGs being defined, we've seen an increase need for additional data for addressing both the decentralized, more detailed information about services, and in particular WASH services in this case. We believe that an effective monitoring is core to a well-functioning WASH sector, and it drives a coordination across the different sectors and across actors. And WaterAid, as within the system strengthening approach, we support governments to build and strengthen their WASH monitoring systems so that the data and there is availability of continuous, reliable, and relevant data and right indicators. You can see here on the graph, this is our how we present our system strengthening approach and the different key building blocks that we support and strengthen to ensure an effective WASH system. And we believe that monitoring and effective WASH monitoring is key to drive also other effective building blocks, in particular evidence-based decision and accountability, policy, planning, budgeting, and resource allocation, so that there is equity and sustainability of services. So why we're looking at wealth index then? So within households wealth, this household wealth can have a large impact in the way that households in low and middle income have access to different WASH services, as we have heard also in other presentation. And often those households who cannot have access or have limited access to WASH services, it is because of wealth, but also because of other inequalities aspects, such as lacking, for example, political power or education. We've seen some countries examples where, for example, here we present examples of Cambodia, where the lowest 20% quantile of the population had access, only 13% of the lowest 20% population have access to at least basic sanitation. And that's so little compared to what we see with the wealthiest quantile, which in Cambodia, for which 92% have access to basic sanitation. So we can see, and we observe this in many countries, a very diverse WASH service levels access across different wealth quantiles. So, as we heard before as well, wealth quantiles are widely used in government, statistical office in particular, who use the information for in censuses or in DHS surveys. And it's obviously very useful to classify the population by different wealth quantile to inform the planning, the WASH service delivery, and also financing to ensure that the right technology, the right services are being implemented in the right context. It's also very useful to inform how households and communities that need to be targeted with specific programs. In particular, we look at subsidies for water supply or subsidies for building latrines. It's also essential to track progress within the poorest part of the population and ensure that we can drive advocacy and policy agenda on this. So how in WaterAid have we actually used the equity tool? We've integrated the equity tool in a number of ways that we are currently collecting information and data across our programs, but also in how we support the sector to collect data in WASH data. So in particular, we have integrated the equity tool on an existing sector data collection tool, which is called mWater, which has been used across a number of governments and NGOs in the WASH sector. And we have built inside mWater a number of the equity tools indicators already embedded inside the mWater library of indicators. This is a library that includes a number of indicators, for example, SDGs indicators, and also the equity tool one. So that means now this tool is available for everyone. This is a free tool, everybody can use it. So also the indicators on the tool can be pulled into any survey and used for consistency and very easily by everyone. And the tool also allows for automatic data visualization, which I will do a demonstration in a minute as well. So just a quick background on mWater. As I said, is a free tool, is an open access system that is used by governments and NGOs. It consists of both a mobile-based data collection and a data portal where you can manage and visualize data. It's been used now by over 100,000 users, and WaterAid has been adopted after a review of different tools since 2013, and we have invested in the platform so that it can be a platform and a tool for everyone in the WASH sector. In particular, we have included also the equity tools indicators in its capacity. So how to use this? It's quite rapid. You just need to sign up for free, just in an email address on mwaterportal.co. You can start a new survey, you look for the equity tool indicator in our library of indicators, and then you can add it into any survey, deploy the survey, start collecting data, and you can visualize the data. So it's very rapid. I'll just show you briefly. This is the mWater portal. I have just gone to start a new survey. And then what we can do is that we go into indicator library. And as you can see, just typing equity tool, you have a number of different indicators and equity tool indicators that has already been developed. So we're just going to add to the survey. And we already have now all the equity tool questions already built on our survey. That means then we can add additional indicators. In particularly, we have, as I said, SDG 6, because it's a wash sector platform, we have all the indicators for SDG 6 embedded that can be added to the survey. What we can then do is very rapidly analyze data. Just to show you very briefly, this is the dashboard, the way we visualize data. We just look at our data source. This is our Myanmar specific data.
Ellen?
For our indicator.
Ellen, you're not sharing the app that you're demoing. I think you need to redo the screen sharing so that we can see the app.
Apologies. Let me have a look why that's the case. Can you what can you see, the presentation or?
Yes, we see the presentation for now.
Okay. Let me stop sharing and then share this again. Apologies. Could you see the survey? Sorry, I'll repeat. I'll start from. I'll just repeat myself very briefly. Okay. Can you now see it? Sorry, can just confirm.
Yeah, that's good.
Great, thanks. So this is how you can, this is a new survey that we're starting from scratch. I'm going into the indicator library. And then just including equity tool, and I can select the countries. We have at the moment 12 countries that already been built the equity tool on M-Water, but depending on the needs, we are working with M-Water to build more of these, and they can be added as needed. So I select the equity tool I'm interested in and add that to the survey very briefly. And that means we already have all the questions set up as we have seen for other tools. But why this is useful is because we can add other indicators that we have on the library, in particular, as I mentioned, SDG 6 that is included already on M-Water indicator library. And then M-Water allows for very rapid data visualizations. I was just going to show you here, this is dashboard where we can then visualize the data from the equity tool very rapidly by looking at our indicator results from a survey and then selecting our quantiles, and we will have the rapid analysis immediately of the survey. So this is just to show how in WaterAid we've been using the equity tool, and just now going back to the presentation, hopefully this screen change works. Otherwise, let me know. Hopefully you should see the slides. So this is how we've been using it. And I'm just going to go into a bit more detail of how we actually use it in one country. So as I mentioned, in particular, I'm going to share our work in Myanmar, where as WaterAid, we are actually supporting the national government in strengthening their approach to wash monitoring, and in particular, rural water supply work as a starting point, and now moving into sanitation and hygiene as well. So since 2016, we have been working with the government, and these are all pictures of trainings that we've done with government. We trained over 300 staff from the national and local government in different districts. We've been working together in parallel with the government and in collaboration, obviously, because we're strengthening their system. So we wanted to really follow their timeframes as well of their approach to strengthening their own monitoring systems, and really work with them to identify what the gaps and challenges of their monitoring process were. And so therefore identify how we could strengthen and support their processes. And then we went into a phase of demonstration of complementary monitoring models. And that included testing the equity tool. And then in the latest year, we're in the phase of institutionalization and scale up to a whole rollout at national level. So as part of this work, we've integrated the WALF Quantiles into the rural water supply monitoring tools, which we're piloting in a number of districts. We've trained government staff in using the equity tool together with other indicators and also water quality testing, as you can see from this picture. We then worked with the government to decide which data visualization was most useful for them for decision making. These are some of the results from one of the districts where we can see the SDG 6.1 service level ladder, so with different colors addressing different service levels, from darker blue, which is safely managed water, to surface water, which is of red, across the different wealth quantile. And obviously, by using the combination of these two indicators, we could immediately show with very simply how actually different parts of population were accessing very different types of service of water services. So we can see the quantile 1, the lowest quantile, accessing unprotected dug wells, for example, such as in this picture, while the richest quantile of the population, which had higher access to safely managed water supply with, with the distribution systems, with tap stands at their households. So this was very useful to visualize this data with the government so that they could really see the differences of access within communities and across communities as well. So based on our learnings on this work, so the information was considered by the government very valuable, but it was also considered quite labor intensive to collect because it needed obviously household interviews and a lot of additional questions compared to what they were used to. However, and the government feedback was that while they find the information useful, the priority from their side in the regular monitoring work that we were really looking at supporting was on focusing just on the water systems and the water services so that it could inform their planning, budgeting, and operations. But they also recognized that the equity tool data together with combined with the WASH access data was very useful to inform the design of specific programs and specific subsidy programs or behavior change programs that could target part of the population. So they could see it as a complementary data collection that could be done maybe in specific moments of the year, not as a regular monitoring, to really inform more deeper programs that target parts of the population. On the other side, the data was very useful when shared with other organizations and NGOs. Everybody really identified the need for having more of this information to highlight service gaps and to advocate for improved measures that can target the lowest parts of the population. So what are the next steps in terms of using the equity tool and the wealth quantiles analysis? So in way with supporting government monitoring processes, definitely we think we continue to demonstrate how the data can be collected and used to inform targeted programs and to track the impact of programs on the lowest quantile and really close that gap that we all talking about. In water aid programs, we also have obviously our own programs where we are using equity tool. And it is useful to really look at how we can address the lowest, the most marginalized parts of the community. But as part of this, we're also looking at how to integrate the wealth quantile analysis with other inequality measures, similar to other organizations that just presented today, both looking at geographical data, looking at, for example, water services, geographical distribution and household distance to that. And also information on disability with the Washington Group questions that are being used in a number of countries already. And so all of this then can be used to inform program designs and targeting approaches such as subsidies, etc. So that's it from me. I have a link to a dashboard that presents the equity tool on Inequalities and how it can be used on Inequalities. I'll share that in the questions and in the Q&A chat online so that you can all have access and test. Thank you very much.
Thank you, Alan, for sharing WaterAid's experience in measuring equity and in using the equity tool. We've now been able to see various ways in which the equity tool can be used in practice. Let's now turn to some questions from participants. There are a few that I see on the chat box. The first one, I believe Nirali has already addressed it in writing, but for those who haven't seen it, I think it may be worthwhile sharing the response. Nirali, this one came from Mabel Aoun. Thank you for this excellent presentation. What are the steps to include a new country into the process? And I believe, Mabel, asked about Lebanon in particular, but I believe this question applies more broadly. If someone from a country doesn't see that country in the list that's already being for which the tool is available, what are the steps? Can you maybe say a few words about that, Nirali?
Yeah, sure. So the equity tool is a free resource that Metrics for Management develops, and we have kind of a queue of countries that we're updating or adding new countries. So we just have our own development queue, and as we become aware of a data set that is available to us, we will add it to our queue. So for the case of a country like Lebanon, I would suspect that there may not be a data set that we are aware of that we could use. There's no DHS survey, and maybe there's not a corollary survey that we're aware of. There are situations where someone can send us a data set or make us aware of something, and we would help in that way. Thanks.
Thanks, Nirali. Next question, there are a few, let me quickly, one for Ellen by Ariel Frisancho. Could you give us a concrete example of how advocacy on WASH accessibility for poorest households using the app has succeeded on its purpose? Which were the advocacy strategies? Ellen?
Thanks. That's a great question. Okay, so as I said, the case study I was presenting was more about integrating within government monitoring processes, but we have also used the equity tool in some of our programmatic monitoring and also using the information, particularly to inform some plans on increasing water access for the lowest quantile of population with subsidy programs. So there's been a big push around developing kind of localized plans with local governments and local service providers on creating kind of subsidies plans for water access. So we've seen this in Ethiopia, for example, and in Zambia, in a number of countries where we're working on this. It's still a growing experience, I would say, in water aid. And as I said, the advocacy can be done, and the way we use the data, it's both done at the local level to try and work with service providers and service authorities to use the information to improve the targeting of subsidies programs, but also at national level to really highlight the need to address the gap of service access.
Thanks, Ellen. A question for Gregoire from, let me see, from Godwin. And the question is, how do you link the ODK with the DHIS2? And can you also please teach on that? And if possible, share the code.
Thank you for the question. I'm not sure I will teach on that. Sharing the code is probably easier. So it's just to make clear, this is work from a more of our dev team who will be able to tell you more on that. Just small elements, the way ODK lands in DHIS2 is through. There is still a middle layer here, which was called on the version I showed data collect, and which we still maintain. And there is a newer version that we have. And this works both for data, these individual data being collected, aggregated within data collect, and then the aggregated indicators can go to the DHIS2. And then recently we developed the same a similar process to directly enter individual data into DHIS2 tracker, but that's not a DHIS2 session. So I'll just stop at that and encourage you to reach out to us so our team can tell more. And we're in the process of putting part of that system open source. So that's how we would be able to share the code. Thank you.
Thanks, Gregoire. A question, I'm not sure who will be taking this one. How does community verification work, and how do you avoid health facilities from entering fake data in order to increase their payments? Maybe I can ask if either Ian or Gregoire can take this one, or both. Ian, do you have a response to this question?
Hi, yeah, I'm not sure if Gregoire actually used the phrase community verification, but I certainly didn't. But I can certainly explain how we ensure this doesn't happen in the Cameroon Cataract DIB, for example. So as part of the development impact bond, there's a third-party independent monitoring company that verifies and also as part of our cataract outreach program in Malawi, for example, we had self-reporting at the outreach camp, and then participants were also randomly selected, and household visits took place in order to check the validity of that data.
Thanks, Ian. Gregoire, did you have anything to add to that?
No, I think that the process, is fairly similar. There is it's really based on keeping on the community verification part, which is individual verification of effectivity of services to patients. It's based on keeping track of patient visiting, and then having third-party community-based actors paying visit and addressing what type of services were received, etc., etc. I think in the in the FBR world and PBF world, verification is maybe, if you ask me, more on the strong side than it other types of programs. So sure, fake data is a concern, but I think there are some very strong processes and a lot of money being put in verification, which is something we can address also.
Thanks, Gregoire. A question from Ruth Young. Hi, Ruth, by the way. Thanks for the presentation. Most presenters mentioned that they needed to supplement the equity tools with other measures. How do you determine what should be measured as part of these additional measures? Does anyone want to take this question? Maybe Kenda, do you have any thoughts on that?
Sure, I think it depends on the context, really, both which locations you're operating in and also what your program is trying to achieve. So in our case, for example, in Nepal, caste is a major issue. And so that would be definitely something you want to think about, not only wealth. Whereas in another country, maybe that's not as big of an issue, and you'd want to focus on some other dimensions. I think that's important. Similarly for us, because our program is such at scale and we cover really mountainous areas and really lowland plains areas and everything in between, what it means to be remote in a flatland area with roads versus remote in a mountain is extremely different and has consequences for health service uptake in different ways. And so again, I think it's knowing your context and knowing what you're trying to achieve, and thinking through which other dimensions other than wealth might be important to think about.
Thank you, Kenda. Anyone else wants to add to this? No, then let's move to another question, which I think Nirali is best positioned to answer. This question comes from Joris Michielsen, and it's whether the equity tool is also suitable for capturing intra-household equity or inequity.
Great, thank you for that question. So unfortunately, I think the equity tool is not well suited for that. Because we are measuring assets, and assets are usually owned by a household, or at least the way that we measure them. Does anyone in your household own a watch? If the person who's responding to that question does not themselves own a watch, they may still be answering yes, because the head of household owns a watch. And for that reason, I think it's difficult to use the equity tool to capture inequities in wealth within a household.
Thank you, Nirali. I don't see any other question in the chat box, but I do have a few that I kept just in case. One relates to the current context of COVID-19. As you know, it's having devastating impact on socioeconomic conditions throughout the world. To what extent are the results of applications of the equity tool still relevant when we know that your reference population is probably changing or has changed between the time of the survey, the reference survey, and your application of the equity tool in terms of the socioeconomic conditions of the population? So maybe does anyone, Nirali, do you want to start, and maybe others want to add to that?
I would love to hear what other people have to say on that. I think from our perspective, I think the equity tool is not designed to measure shocks, right, or transient, maybe even seasonal changes in wealth, because it's based on assets. Nevertheless, in a situation like we're facing now, where the pandemic is affecting society at large, right, within a country, it might still be interesting to understand how there are differential impacts of COVID-19 or any other situation on different households, within the society. So I think that it could be used to gain some understanding of where the impact of the pandemic is being felt, but it probably can't be used to determine if a household has gotten poorer because of COVID.
Right. Does anyone want to add to that? Yeah, Ian.
Yes, thank you. I think it's partly related to a comment in my presentation where, we're using this as part of a more comprehensive equity analysis. And I think when we're looking at impacts of COVID on equity, particularly equitable access of services, recognizing what Nirali's just mentioned, equity tool might be one part of the puzzle, but we need to supplement that with other tools that can really measure those shocks. It goes back to I think it was Ruth's question and Kenda's response. You really need to be thinking about the context, but also the program and what the objectives of the program were, and really pulling in information and data about the political, socio-economic context within that region, and using a variety of tools, including the equity tool, to achieve what you want to achieve in terms of monitoring your participants.
Thank you, Ian. Anyone else wants to add to that? No. I have one more question. I think we just have a few minutes left. Maybe we can take this one. It's more to do with the do's and don'ts with respect to the use of the equity tool. To what extent can or cannot the equity tool be used for targeting? Because I know this is a question that comes up quite often. Personally, I would say don't use it, because that's not the goal of the tool. It's not meant for it, and it may not do a very good job. But I would like to hear from panelists about what they think about it. Who wants to start? Ellen, maybe?
Sure. So for our side, the way we've been using it in our experience, it's obviously like the main priority is to use it also to track changes and of WASH access within communities. So it is more a measurement of change and a way to really control the impact of our work. For targeting is more about understanding from our side, at least in our experience, is really to understand what proportion of the community require particular measures with delivery of specific services. So it doesn't, it's not something that we use to actually know which household will require what service, because that will need additional surveys and information to target, for example, subsidies. But it definitely provides us an indication of the extent to which certain communities require different measures or different types of service delivery compared to others.
Thank you, Ellen. Did anyone want to quickly add something to that? Yeah, Nirali, we just have 1 minute left, so maybe in a few words.
Yeah, so I'd quickly add that the equity tool, it makes it purposely difficult for you to determine for any given respondent what their wealth quintile is immediately. And the reason for that is because we very quickly realized that it's easy to game the system. There's only a few questions. And so the perverse incentives, become quite strong to game that system quickly. And so while you can use it for targeting, if you had a few steps in between, it makes it a little bit difficult for at least for the survey, for the data collector to be making sure that this household falls in the right quintile to receive the service.
Great, thank you, Nirali. And I think we've come to an end of this session. I'd like to thank you, Nirali, for organizing it. And I'd like to thank all the presenters for sharing their experience using the equity tool and the valuable lessons that they've learned along the way. Also, big thank you to the HSR 2020 team for making this virtual session run smoothly and without any IT problem. Thanks also for all the participants for your interest. I hope you found this helpful, and may it contribute to your integrating equity monitoring in your work. Thank you, everyone, and good rest of the day. Good night. Bye.
Bye, thank you.